Good evening. Thank you for tuning in. My name is Alan Piper. I am the senior politics producer for NowThis, and I am backed up today by our entire newsroom. All of us are working remotely. We are all in states that are under stay-at-home orders, like most of the country. Most of us are in New York City, the global epicenter of the coronavirus pandemic. And so if we run into any technical difficulties today, as we sometimes do, I thank you in advance for your patience. We do not have the full resources of our studio on our to our advantage now. So we're expecting the president to come out any moment, and here he is. And my team and I will work to fact-check him live as he speaks.
I just had a meeting with Kevin McCarthy, future Speaker of the House, I hope. And he's done a fantastic job for the people of California, and also the people of California have done a fantastic job.
Kevin McCarthy, by the way, was the person expected to become the next Speaker of the House in 2016. But he stepped down from that position after publicly saying on Fox News that the purpose of the Benghazi Special Committee was to lower Hillary Clinton's poll numbers. Following that embarrassing gaffe, he stepped down, making the path open for Paul Ryan. And of course, now that Democrats have taken the House, it is Speaker Pelosi who is in that position.
In loans in 2 hours. For anybody who's in small business, I had first small business when I was 20 years old. You don't have income coming in right now. You get a loan, but for your rent, paying your employees, and paying your utilities is a grant. That's part of the CARES Act. And I think you're going to find that a lot of small businesses are going to hire people back, keep them afloat through the next 2 months, and get this economy moving again as we get through this virus. So I just want to thank you for all that work.
Thank you. Great job you're doing.
Thank you.
Thank you. You go ahead, Steve.
I'll talk to you later. All right.
Okay, thank you very much, everybody. And I want to start by saying that our hearts go out to the people of New York as they bear the brunt of the coronavirus pandemic in America. That seems to be the hot spot right now, but you have some others, as you know, that are very, very bad, very bad. Louisiana is getting hit very hard. Parts of Michigan are getting hit very, very hard. New Jersey is surprisingly, it's much greater than anybody would have thought. They're doing a really good job. Governor's doing a really good job out there. New York's first responders, EMTs, doctors, nurses are showing incredible courage under pressure. They're the best in the world. We will take every action and will spare no resource, financial, medical.
The president is celebrating the doctors and nurses of New York. For the past few days, he has been accusing them of stealing, suggesting that the reason that there is a shortage of medical supplies is because they may be, quote, going out the back door.
100 beds, and we're going to allow that to be a system where this horrible disease can be looked after, the patients can be looked after. That was going to be for regular medical problems, such as accidents. And, you know, it's very interesting. The governors tell me we don't have too many accidents and very few people driving. So we're going to put that facility into play, which is a big facility. The ship will be staying the way it is, but we're putting that facility into play to help them. And today also the CDC is announcing additional steps Americans can take to defend against the transmission of the virus. From recent studies, we know that the transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure. So it's voluntary. You don't have to do it. They suggest it for a period of time. But this is voluntary. I don't think I'm going to be doing it, but You have a lot of ways you can look at it as follows. The CDC is recommending that Americans wear a basic cloth or fabric mask. They can be either purchased online or simply made at home, probably material that you'd have at home. These face coverings can be easily washed or reused. I want to emphasize that the CDC is not recommending the use of medical grade or surgical grade masks, and we want that to be used for our great medical people that are working so hard and doing some job. Medical protective gear must be reserved for the frontline healthcare workers who are performing those vital services. The new mask guidelines also do not replace CDC's guidance on social distancing, including staying in your home when possible, standing at least 6 feet apart for a period of time. Again, we're going to all come back together here. We're going to all come back together and practicing hand hygiene, which we should do anyway. A lot of things I think are going to spill over. Shaking hands maybe will stay with our country for a long time.
So the president is sharing the CDC's guidance that when you go outside, it is best if you wear some form of mask. And then he's following that up by immediately saying he's not going to do it. He's also saying that the CDC recommends that people remain 6 feet apart from each other. And when the camera pulls out a little bit more, take note of the fact that he and his team are not standing 6 feet apart from each other. Also, it is really remarkable to note that he and the vice president and the top health officials dealing with this crisis are remaining in close physical proximity on a daily basis.
Probably will. They're making a recommendation. It's only a recommendation. It's voluntary. We're also taking action to ensure the cost of no barrier to any American seeking testing or treatment of the coronavirus. The largest insurer nationwide, the Blue Cross Blue Shield system, has now announced that it will not require any co-pays, which is really something. That's a tremendous statement, from patients of the virus treatment for the next 60 days, similar to the commitments of Cigna, Humana, Anthem. Those are great companies, and they're all doing the same thing. So co-pays, for them to do that it's a big statement.
Now, the president is highlighting the fact that a number of health insurance companies are waiving co-pays for coronavirus treatment, and that is great news for people who have health insurance. There are a great many Americans who don't have health insurance, and there are Americans who have had health insurance and are at risk of losing it because they've lost their jobs. For this reason, many people, including Joe Biden, have been calling upon President Trump to reopen the Obamacare exchanges so that people who do not currently have health insurance can purchase it. And President Trump says he will not do that.
Production Act to prohibit export of scarce health and medical supplies by unscrupulous actors and profiteers. The Secretary of Homeland Security will work with FEMA to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. We need these items immediately for domestic use. We have to have them. But we've done really well with the purchase of items, and you'll be hearing about that shortly. We've already leveraged the DPA to stop the hoarding and price gouging of crucial supplies. Under that authority, this week, the Department of Health and Human Services, working with the Department of Justice, took custody of nearly 200,000 N95 respirators, 130,000 surgical masks, 600,000 gloves, as well as bottles, many, many, many bottles, and disinfectant sprays.
The president is highlighting the work that he has done to try to stop price gouging, but one of the biggest causes of the increase of price of goods is the fact that at his direction, states have been bidding against each other for supplies. On March 16th, he told governors to try to get these supplies on their own. Governor Cuomo has repeatedly pointed out that the cost of N95 masks has gone up by 1,000% because states are bidding against each other for these supplies.
They were very grateful. 8.1 million, and we're going to be increasing that number from 8.1 million to more. That's a lot of N95 respirators. Today my team spoke with the CEO of Ochsner Health and the CEO of LCMC, the two largest health systems in New Orleans. They said they feel that they currently have enough ventilators. I think a lot of people are going to have enough ventilators and masks and appreciate what we did and all of the things we've been doing with them, working with them. The CEO of Ochsner, Warner Thomas, who's really been fantastic, I have to say, indicated...
The president is saying that he believes that people will have enough ventilators. I want to highlight that New York has requested 30,000 ventilators, and FEMA has provided 4,000. And the governor of New York has warned that New York is on track to run out of ventilators by Sunday. Louisiana requested 14,000 ventilators and got 292. Illinois requested 4,000 and got 450. New Jersey requested 2,500 and got 850. Virginia requested 350 and didn't get any. And furthermore, the New York Times reported this week that thousands of ventilators that have been sent to states are broken, and that at least 170 of those received by California were broken.
More people in the New York area, so we're going to have it manned by the military, Javits Center. National Guard members have been activated to help states build new treatment centers and assist in the seamless distribution of medical supplies. That includes National Guard. The National Guard is assisting very strongly because the states were, in many cases, unable to have the delivery capability from warehouses and other places that we put the supplies. So I've given approval to use the National Guards, the various National Guards in the different states. And they're doing a fantastic job of not only protecting people, but delivering material. The Army Corps of Engineers has assessed more than 100 facilities in all 50 states and is rapidly building temporary hospitals and alternative care sites in many states, in New York, New Jersey, Michigan, Pennsylvania, Arizona, California, Colorado, Florida, Illinois, New Mexico, Oregon, Washington, Wisconsin, Ohio. They're doing a lot of work, and just those states plus additionals that are will be announced probably tomorrow, but they're doing some job. The Army Corps of Engineers, what a job they're doing, and FEMA, what a job they're doing. As we deploy the power of our military, we're also deploying the skill of our doctors, scientists, and medical researchers. We continue to study the effectiveness of hydroxychloroquine and other therapies in the treatment and prevention of the virus, and we will keep the American people fully informed in our findings. Hydroxychloroquine, I don't know, it's looking like it's having some good results. I hope that would be a phenomenal thing, but we have it right now.
The president has made a variety of confusing and misleading statements about hydroxychloroquine. If Dr. Fauci is given an opportunity to speak about it at this press conference, he is likely to say what he has repeatedly said, that it is one of many things that are being tested, but that it is not approved for use for treatment of the coronavirus. Please do not try ad hoc remedies at the suggestion of the president. A couple in Phoenix ingested fish tank cleaner because they believed that it contained the chemical that the president was referring to, and one of them died.
Paycheck Protection Program, as Kevin said, more than $3.5 billion in guaranteed loans have been processed to help small businesses keep their workers employed during the unprecedented time, And Bank of America.
Just to further follow up on that, Dr. Fauci told Fox News today, we still need to do, specifically when asked about chloroquine, he said, we still need to do the definitive studies to determine whether any intervention, not just this one, is truly safe and effective. The president could not be more different in tone regarding this chemical from his actual medical health advisors.
Small business, in turn, take care of employees that they would have had to let go, and now they'll keep them. And that's good. And then they're going to open for business, and they're going to have their employees, and we'll try and get back to where we were. Eventually, we're going to supersede where we were. The energy industry has been especially hard hit in the crisis. This afternoon, I met with Greg Garland of Phillips 66, Dave Hager.
The president repeatedly presents very rosy pictures as to how quickly the economy will recover following this crisis. The Federal Reserve has indicated that we could be looking at 30% unemployment for some period of time. And even when things return to normal, it is also important to bear in mind that the financial relief bill that was recently passed has added $2.2 trillion to the debt, which will make it more difficult for the economy to recover.
There's a tremendous abundance of oil, primarily because of the virus. The virus has just stopped demand of everything, including oil. So we're working with our great energy companies. These are great companies. They employ tens of thousands, hundreds of thousands of people, and they've kept America really going for a long time, and no big price hikes, no big anything. I mean, they've just kept it going, and now they got hit. But with all the jobs and all of the good that they do, we're going to make sure that they stay in good shape. America is engaged in a historic battle to safeguard the lives of our citizens, our future society. Our greatest weapon is the discipline and determination of every citizen to stay at home and stay healthy for a long time. And we want them to stay healthy for a long time. So stay at home. This is ending. This will end. You'll see some bad things, and then you're going to see some really good things. And it's not going to be too long. We will heal our citizens, and we will care for our neighbors, and we will unleash the full might of the United States of America to vanquish the virus. And with that, I'd like to ask Mike Pence to come up, Vice President, say a few words, and we'll have a couple of other quick talks on a couple of subjects, and we'll take questions. And it's a beautiful Friday in Washington, D.C., and our country's a great place, and we're getting better. We're getting better very quickly. This was artificially induced. We just said, they said, close it down. You have to close it down. We closed it down, and we're healing, and we're going to get it better fast. So, Mike.
So the president there driving home the point again correctly that Americans need to stay home to prevent the spread of this disease, but he has consistently stopped short of calling for an actual nationwide stay-at-home order. Today, Dr. Fauci was saying that the federal government should mandate a nationwide stay-at-home order to prevent the spread of COVID-19. And an increasing number of scientists are pushing for this nationwide lockdown. Experts say that if some states go back to normal too quickly, it will unnecessarily add months and needless deaths to this crisis. Now, Vice President Pence is speaking. He is the head of the task force. It is always important to remember that as governor of Indiana, his public health policies contributed to the worst HIV outbreak in the state's history. And please excuse my cat for walking behind me.
Distancing and all the measures that state and local leaders are advising, and that the president has been advising in the coronavirus guidelines for America. We're also continuing to track significant outbreaks in New York State, New Orleans, Detroit, Chicago, and Boston. And as the president indicated, we're prioritizing resources to support healthcare workers and to support those that are dealing with the coronavirus in those communities. On the subject of testing, now more than 1.4 million tests have been performed across the country. And as you all are aware, some 266,000 Americans have tested positive for the coronavirus. Abbott Instruments, which now can perform a 15-minute test across the country, have literally 18,000 of their machines across the nation today. But at the president's direction, FEMA is acquiring over 1,200 more machines to distribute to every state public health lab in America. and also to our Indian healthcare service. And the big news, of course, over the last few days was that the FDA, once again in near record time, has approved an antibody test developed by Cellex, and we're continuing on the White House Coronavirus Task Force to examine ways that we can scale up these rapid tests and these innovative new tests, not just to meet this moment, but to lay a foundation for testing across the nation in the months ahead. As the President mentioned, he met with energy executives today and continues to engage with leaders of businesses all across the nation. We also held a teleconference today with commercial retailers. On the President's behalf, we thanked them for the way that people that operate malls and shopping centers around the country have embraced and enacted the coronavirus guidelines for America. It's had enormous impact on their businesses and their industries, but I heard from them their patriotic commitment to put the health of their associates and their customers first, and it was deeply inspiring. On the subject of supplies, the President detailed our work in that space. It continues to this day. Part of our air bridge, we had a flight arrive from China today to Columbus, Ohio. We continue to work each and every day watching the data about cases to ensure that in particular, not just the personal protective equipment is available for the healthcare workers that are on the front lines, but also that ventilators are available. As this epidemic makes its way through regions and communities, we are literally working hour by hour, day by day, to make sure that patients, families, and healthcare providers have the equipment and the support that they need. As the President mentioned, we've seen over $1.5 billion.
The administration keeps offering assurances that states and local governments will have what they need to meet the crisis. Both Trump and his advisor son-in-law, Jared Kushner, have scoffed at Governor Cuomo's request for 30,000 ventilators, claiming that it was unfounded and that the state did not need that many. Again, Governor Cuomo says that the state is due to run out of ventilators by Sunday.
Already expanded to coronavirus treatment and testing early on. And of course, the President just indicated how major insurance companies across the country are not just waiving copays on testing, but they're now waiving copays for at least 60 days on any coronavirus treatment. But now, as Secretary Azar will enumerate, and now we'll make sure that any American, even those that have no insurance, will be able to receive treatment in a hospital and never have to worry about the bill. I just give a general reminder to every American, if there is evidence across the country that you're putting into practice.
The Vice President said that they are working on assuring that even Americans who don't have insurance won't have to worry about the cost of coronavirus care. That is a good plan, but something that could be done immediately would be to allow more Americans to currently buy insurance right now by reopening the Obamacare marketplace.
We will get through the coronavirus to that day of renewed health, renewed prosperity that the President always describes. But we'll get through there sooner, and we'll get through there when we work together. Dr. Burke?
Thank you, Mr. Vice President. Mr. President, thank you for your words of discipline and determination. I guess that really describes what we're asking every American, to really be disciplined about these guidelines and really determined to stay in that space of execution. You know, we are just in week 3 of this full guidance measure. We really do appreciate the work of the citizens of California and Washington State, because we do see that their curve is different. Their curve is different from New York, New Jersey, and Connecticut. And we really believe that the work that every citizen is doing in those states is making a difference, and it will make a difference for the frontline healthcare providers. We also are deeply grateful that despite the way their curve looks today, they continue to get ready for a different potential.
Dr. Birx correctly pointed out that we are in week 3 of these emergency guidelines that the President has put forward. It's also important to note that we are in week 11 of the coronavirus being present in the United States. And a great part of why we are where we are now has to do with the fact that the emergency guidance didn't begin until March, when the disease was present, known about here in this country since January.
That they have the supplies that they need in coordination with state and local governments, and to work. I think we discussed it yesterday, but I think it was quite clear also and reiterated by Governor Cuomo today that we have to support one another as each of these different metro areas and other areas move through their peak of new infections. When we talked about it at the beginning of this week, we talked about this week and next week being incredibly difficult. And we want to recognize the number of Americans who have lost their lives to this virus, and recognize the sacrifice that healthcare providers are making both in their care, but I think I'm very uplifted by hearing their messages to families and their compassion for others to provide that kind of support to the individuals in the hospital. We continue to watch, in addition, the Chicago area, the Detroit area, and have some developing concerns around Colorado, the District of Columbia, and Pennsylvania. So as you can see, each of these will follow their own curves. We'll be getting more and more of those case over time information in a very granular way to each and every one of you, so that we can follow these epidemiologic curves as each of these states, counties, and communities move through this together in solidarity, and really ensuring that we can move supplies creatively around the country to meet the needs of both the frontline healthcare providers, but also every American who needs our support right now. Thank you.
Thank you very much.
Well, thank you, Mr. President, for your continued leadership as we battle the coronavirus. First, I want to thank all of the members of the HHS team and the frontline healthcare workers across America, including those service workers who serve in our hospitals and our healthcare facilities, those who clean, those who deliver, those who stock the shelves, all those who are going into battle every day against the virus. Your country's asked you to serve as never before, and you have responded heroically. I'm going to provide a brief update on the administration's plans to cover the testing and treatment for the uninsured. Getting the uninsured access to the care they need is a top priority for President Trump. We are already rolling out the $1 billion in funding from the Families First Coronavirus Response Act to cover providers' expenses for
he says that getting people without insurance access to care is a top priority for the President. One very simple step toward that would be to enable people who do not have insurance to purchase insurance by reopening the Obamacare marketplace, which the President refuses to do.
Used for testing. As a condition of receiving funds under this program, providers will be forbidden from balance billing the uninsured for the cost of their care. Providers will be reimbursed at Medicare rates. We will soon have more specifics on how the rest of the $100 billion will go to providers. We're working to ensure that this funding is distributed in a way that is fast, fair, simple, and transparent. I'd also like to remind people that if you've lost employer insurance coverage, you have insurance options that you should look into. You'd be eligible for a special enrollment period on the healthcare exchanges. And depending on your state, you may be eligible for Medicaid. Just as President Trump is working to...
An addendum I want to add to that. Secretary Azar has correctly pointed out that the state exchanges are under the jurisdiction of the states, and New York has reopened the New York marketplace for insurance. So if you happen to be at the epicenter of the coronavirus pandemic here in New York, you have the opportunity to sign up for health insurance. And we'll provide that URL for you during this broadcast.
It gives us data rapidly. If you are a doctor or a healthcare provider and you would like to help us, you can sign up today to begin reporting on your work. There's a special registration page for providers at covid19.oracle.com. Thank you very much.
For New Yorkers watching who do not have insurance and are seeking to get it, that website is nystateofhealth.ny.gov. That is all one word, nystateofhealth.ny.gov. If you are in another state, you should check with your local state marketplace and see if it is possible to sign up for insurance.
Resolute desk, the great Resolute desk. I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself. I just maybe I'll change my mind, but this will pass.
The president has consistently refused to model the behavior that he is asking people to undertake. The CDC has made its guidelines official that all Americans should wear masks when they are outside. The president has just said he won't do that. We have been advised that we should all seek to stand 6 feet apart. Look at how close the president is standing to the vice president and to Dr. Birx.
Great question that you ask. It's a fair question that you ask. I want to unpack the evolution of our guidance on masks because it has been confusing to the American people. First of all, I want people to understand that the CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19. We have always recommended that symptomatic people wear a mask because if you're coughing, if you have a fever, if you're symptomatic, you could transmit disease to other people. What has changed in our recommendation? Well, it's important to know that we now know from recent studies that a significant portion of individuals with coronavirus lack symptoms. They're what we call asymptomatic. And that even those who eventually become pre-symptomatic, meaning that they will develop symptoms in the future, can transmit the virus to others before they show symptoms. This means that the virus can spread between people interacting in close proximity. For example, coughing, speaking, or sneezing, even if those people were not exhibiting symptoms. In light of this new evidence, CDC recommends and the task force recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. These include places like grocery stores and pharmacies. We especially recommend this in areas of significant community-based transmission. It is critical, and the president mentioned this, the vice president mentioned this. It's critical to emphasize that maintaining 6 feet of social distancing remains key to slowing the spread of the virus. But CDC is additionally advising the use of simple cloth coverings to slow the spread of the virus and to help people who may have the virus and do not know it from transmitting it to others. The cloth face coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by the current CDC guidance. As the president also mentioned, cloth face coverings fashioned from household items or made at home from common materials at low cost can be used as an additional voluntary public health measure. This recommendation complements and does not replace the president's coronavirus guidelines for America, 30 days to slow the spread, which remains the cornerstone of our national effort to slow the spread of the virus. CDC is always looking at the data. We've told you that from the beginning. Dr. Birx says it every single press conference. We're looking at the data, we're evolving our recommendations, and new recommendations will come as the evidence dictates. So I want to say if you do choose to wear a face mask, very important, wash your hands first because you don't want to put on a face covering with a dirty hand. Do not touch your face while you are wearing the face covering, because again, you could take materials from the surface, germs from the surface, and bring it to your face. If you choose to wear a face covering, please leave the N95 mask, the medical supplies for the medical professionals, healthcare workers, and frontline workers. Know that this is not a substitute for social distancing. And remember, this is all about me protecting you and you protecting me. This is about us coming together as communities, and if people voluntarily choose to wear a face covering, they're wearing it to protect their neighbors from getting the coronavirus, because again, they could have asymptomatic spread. So, Mr. President, thank you very much for that. Appreciate the opportunity to update everybody.
Now, I do want to clarify in the reference to the idea that this is recently learned that we find that asymptomatic people can spread the disease. Public health officials have been warning since at least January that that was the case. The new information is just how many, that up to 25% of people with the coronavirus may be asymptomatic. However, it was the governor of Georgia who claims to have just learned for the first time this week that it is possible for someone who is asymptomatic to spread the disease.
Right?
Thanks,
we
Mr.
had
President.
I heard a different voice. I heard a much different voice. Go ahead. We'll get you later.
Going to the oil meeting previously, is the U.S. willing to cut domestic oil production? What came out of the meeting? What was the consensus?
Well, a lot of things came out. It's a great industry. It's an important industry. It's a tremendous job-producing industry. And it's just vital. And it was also very interesting because they all were given the test before they came into the room. So you have the head of ExxonMobil, you have all these guys taking the test, and they all passed with flying colors, so that was good. They left happy in that respect, at least. There's just an overabundance of oil right now, oil and gas, a tremendous overabundance, and it was caused, they were doing a great job. They were producing a lot of energy, but then you had the virus come along and it knocked another 35%, maybe 40% off of the market. So there's too much oil. There's a glut.
Now, the president is praising the oil industry as a wonderful industry. It is important to know that in addition to just the basic pollution of oil that we have known about since the beginning of its use, most Americans did not always know about the dangers of fossil fuels in terms of climate change. We now know that, similar to the tobacco industry actively working to hide research that showed that cigarettes cause cancer, the oil industry was actively engaged in an attempt to conceal data and spread confusion and skepticism over data that indicated that fossil fuels were contributing to climate change.
Sure, we keep it that way. All right, please, go ahead.
Mr. President, as I was saying, the Food and Drug Administration, to address the shortage in the blood supply, announced yesterday it would ease the restrictions on certain donors, including gay men, who are now required to be abstinent for 3 months as opposed to 12 months to donate. Do you have a hand in that change?
No, I didn't know anything about that. That was done by the FDA, very capable people at the FDA.
Yes, Mr. President, both the government of Canada and 3M are pushing back on this DPA not to export N95 respirators. 3M says...
I don't blame them. They can push back if they want. We're not happy with 3M. We're not happy. And the people that dealt with it directly are not at all happy with 3M. So we'll see whether or not we do. I heard what he had to say today. I don't know the gentleman, but we're not happy with 3M. Go ahead.
And where is Dr. Fauci?
I don't know, but every time you ask that question, whenever he's not here, you look, you say, where is he? And you'll say, is there a problem? No problem whatsoever. Every time he's not here, sometimes I'll ask him to come because that's the first question that you and a couple of others from the fake news establishment ask is, where's Dr. Fauci? We're doing great together.
Different subject, if I may
Except
ask.
we're covering a different subject today. Go ahead.
Different subject, if I may,
Go ahead,
if I may
Jim.
ask.
Try another
Mr.
one.
President, you have said nobody could have seen this pandemic coming. But in fact, Secretary Azar at a biodefense summit in April 2019 said, of course, the thing that people ask, what keeps you most up at night in the biodefense world? Pandemic flu, of course. I think everyone in this room probably shares that concern. Your own Health and Human Services Secretary was aware that this had the potential of being a very big problem around the world, a pandemic of this nature. Who dropped the ball?
Well, I always knew that pandemics are one of the worst things could happen. There's been nothing like this since probably 1917. That was the big one in Europe. It started actually here and went to Europe, probably. I've heard about, excuse me, wait a minute, let me finish. I've heard about this for a long time, pandemics. You don't want pandemics. And I don't think he was talking about a specific pandemic. He was talking about the threat of a pandemic could happen, and it could happen. Most people thought it wouldn't, and most people didn't understand the severity of it. This is very severe. What's happened is very severe. But I'd let you answer that. I assume that he was talking about the concept of a pandemic.
Thank you, Mr. President. Actually, absolutely. For 15 years now, this country has had a massive effort at the federal, state, and local level of preparedness for pandemic. Now, that largely has been, as I said in those remarks, about pandemic flu preparedness. We knew about SARS, we knew about MERS, which were earlier modifications or variants of the coronavirus. None of those achieved anything like what we're seeing today. But that's why for successive presidencies, including the leadership of President Trump, there has been a great focus on pandemic preparedness. In fact, it was just in November, I believe, that the president signed the Pandemic Flu Preparedness Executive Order.
Now, there's a lot of misinformation happening right now, and suggesting that the president was amping up our ability to face a pandemic is simply false. It is President Trump who fired the National Security Council's Global Health Security Unit that President Obama had established to specifically be on the lookout for this type of crisis. We released an interview with a member of the Obama administration this week that highlighted how the administration prepared a pandemic playbook, leaving a recipe for whoever the next president might be as to how someone could address a pandemic. And the president did not choose to do that. He has repeatedly tried to cut the CDC budget. Last month, after the World Health Organization had already declared the coronavirus a global emergency, President Trump sought to cut the CDC budget by 16%. He also specifically did not renew CDC epidemic prevention funding, which caused it to downsize in 39 countries, including China. Had the CDC been working in China, we could have more quickly responded to this crisis.
If Spain, who has big problems, these are countries with tremendous problems, France, if they have long-term orders and they're in there and they want to get certain things, I'd let them go out in certain instances because I think it's only fair. They have problems that are proportionately or relatively bigger than our problems. So if they ordered something and they're waiting for, as an example, masks made here and going to Italy, I'm not going to be stopping that. I think it would be very unfair. And by the way, speaking about being fair and unfair, two very big cruise liners, as you know, I allowed them to dock today. We worked with the governor of Florida, as you know, Ron DeSantis, and we worked on it, and we had tremendous security, and we took the sick people, and we're working with them. We have doctors. We have great doctors, military doctors. And from a humane standpoint, not that we're in love with this. These are two massive ships, but we have to take care of people. We have to take care. We sent many back to Canada. The Canadians came and worked very closely with us, as did the UK. We had a lot of people from the UK, and we took care of the Americans. We took care of the sick. We had some people very sick. I think we had 3 to 4, maybe 5 people that had died on the boat, one of the boats actually, and we had to take care of these people. So we could have let them float aimlessly into the ocean looking for port, as they've been doing for a long time. And I made the decision we had to take them in, and Homeland Security and a lot of other people did a great job. But we had to help people. These are people that were very, very sick. Some were dying, some died. Please.
Go ahead,
go ahead.
Mr. President, your staff today said that people in close proximity to you and the Vice President will get a coronavirus test. I'm wondering, are you concerned that the people you've been hanging around with may have the virus?
No, I'm not concerned, no. I had a test yesterday.
But what's the reason for the order for people who meet with you or talk to you? Why?
I don't know. I mean, I
test?
heard from the oil executives, these are people, most of them had not had the test. And frankly, I think they left the room feeling good about a lot of things, but they felt good about the test. This was a test that took, I guess, 13 minutes to have it finalized. They took the test. I don't know. I didn't know they were doing that. Maybe they did it just for them. I don't know. But it seems that a lot of people, because now we have tests that really work well. Abbott in this.
I want to point out what the president is saying here. He is continuing to hold meetings in person in the White House in small rooms with not just his own team, but with leaders of industry. Phones exist. Teleconferencing equipment exists. We have seen on occasion that President Trump apparently has struggled with the phone on the Resolute desk in the Oval Office, but it is possible, as so many of us working from home have found out, to not be in the room with these people. It seems striking that the president is so adamant in personally rejecting the guidance that he is giving to the rest of the country.
Hospitals, the states, the cities, they're supposed to get everything they can and stock up in case something like this happens. But nobody could ever have assumed that something like this happened. So we started supplying. We brought tremendous amounts to New York today and over the last few days. We brought them to Louisiana. We brought them to Michigan. We brought them to Los Angeles. A lot of equipment. You've read the amount of masks that we had. I think I said over 8 million masks. The N95 masks, the more expensive, more complicated, better, whatever masks, the ones that want to use in the hospitals. We have millions of them now, and we've given.
Okay, there's a lot going on here. The president is highlighting the fact that there are now 8 million masks. The Department of Health and Human Services has estimated that the United States will require 3.5 billion masks if this pandemic lasts for a year.
I would be, gowns too. We have many gowns being delivered and have been delivered. Our people have done an incredible job. Most people have said now, and I said this yesterday, governors have said, thank you very much, great job. If they're a Democrat governor, in some cases, not in all cases at all. If I said, here's 1,000 ventilators, how many do you want? We want 1,000. Here's 1,000. You got them. But you know what we're going to do? We're going to add another 5,000. Is that good? They said, wow, that's great. And then if Jim Acosta goes and says, are you happy with the president? No, he should have given us 10,000. That's what's happening. You know why? Because that's a standard political answer.
Okay, the president is making a claim that the evidence does not support. He's suggesting that he is giving governors more equipment than they are requesting. That may be true that actually may be true in certain states with Republican governors. But I'll just refresh your memory on these numbers again. New York requested 30,000 ventilators because that is what the science suggests that New York will need. They got 4,000. Louisiana requested 14,000 ventilators, got 292. Illinois requested 4,000 ventilators, got 450. New Jersey requested 2,500, got 850. Virginia requested 350 and didn't get any.
And Saudi Arabia, I think they want to get it. Yeah, I think they want to get it resolved. I think they're working very hard. I mean, they told me they want to get it resolved. They're working very hard. Go ahead.
Thank you. Yesterday, Jared Kushner said the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be state stockpiles that they then use. What did he mean by our?
Oh, why didn't you ask him?
And given the fact that taxpayers from
What's
every
that? I
state
got you.
pays
I got
for
you.
it. No,
Use
it's
the
not
word
a
our.
gotcha. What do
Our,
mean
you know
by
what
that?
our means? United States of America. That's what it means. It means
the states.
our. It means the United States of America. And then we take that our and we distribute it to the states.
So why did you
Not
say
that we
it's
have
not
to.
supposed to be state stockpiles that they then
Because we
use?
need it for the government and we need it for the federal government. But when the states are in, no, to also
Then
keep,
you're giving it to, it's not to the states.
to keep for our country, because the federal government needs it too, not just the states. But out of that, we oftentimes choose, as an example, We have almost 10,000 ventilators, and we are ready to rock with those ventilators. We're going to bring them to various areas of the country that need them. But when he says our, he's talking about our country. He's talking, excuse me, he's talking about the federal government. I mean, it's such a basic, simple question, and you try and make it sound so bad.
The president is saying a lot of things that aren't true, but I want to let him get through saying them because he seems to be very worked up.
He said our, and our means for the country, and our means for the states because the states are a part of the country. Don't make it sound bad. Don't make it sound bad. Go ahead, Steve. Go ahead, back here. You just asked your question. You just asked your question in a very nasty tone. Let's go.
You didn't give me an answer.
Please.
Mr. President,
I gave you a perfect answer. You know it. Go ahead.
well, just to follow up on that, when we have the federal stockpile, I mean, isn't that designed to be able to distribute to the states?
Sure, but it's also needed for the federal government. We have a federal stockpile, and they have state stockpiles. And frankly, many of the states were totally unprepared for this. So we had to go into the federal stockpile. But we're not an ordering clerk. They have to have for themselves. Now, some of the states were in good shape. Some of the states were not in good shape. That's probably something you could expect. We have been helping states. We have been spending a tremendous amount of time, effort, and billions of dollars on making sure that they have what they have. I mean, take New York. We built them hospitals. I built them 4 hospitals, built them medical centers, sent a ship with 1,000 rooms and 12 operating rooms. And then on top of that, gave vast numbers of ventilators and vast numbers of surgical gowns, equipment, masks, everything else. Now, they had a chance to order ventilators over the years. They had a chance to order a very big, but they didn't choose to do it. We were there and we helped them. And I think the governor of New York is very thankful for the help that we gave. But we have a stockpile. It's a federal stockpile. We can use that for states or we can use it for ourselves. We do use it for the federal government. We have a very big federal government. Go ahead.
You decided not to use your powers to be essentially a traffic cop for all the essential medical supplies that are needed.
We're not a traffic cop. We're a humanitarian cop. We help. It's like the ships. Do you think we wanted to take 2 big ships into our country that have obvious problems, and you know the problems I'm talking about? So I have a decision to make. Do I take them in or do I save lives? Okay? Do I take them in or do I save? I decided to take them in. And we have tremendous protection. We have great doctors there to help the people. They had 4 or 5 people that died. That was as of last night. They died on the ships. We took care of it. And now the people are in the process of, and many are already back in Canada, they're back in the UK, United Kingdom, and many of them were American citizens. Some were very sick. We're taking...
Okay, I didn't want to interrupt for a while because the president was getting so heated, but I do want to extrapolate a little on this question about the puzzling thing that Jared Kushner said yesterday. He said, all right, well, first of all, just setting aside how puzzling it is that the president's son-in-law with zero experience in emergency management is playing a lead role in managing what is arguably the greatest emergency of the past century. Jared Kushner said, the notion of the federal stockpile was it's supposed to be our stockpile. It's not supposed to be the states' stockpiles that they then use. This is a confusing statement in itself because who are the residents of America if not the residents of its states and territories? But it also is directly contradicted by what was on the Strategic National Stockpile website, which said, when state, local, tribal, and territorial responders request federal assistance to support their response efforts, the stockpile ensures that the right medicines and supplies get to those who need them most during an emergency. The Strategic National Stockpile website specifically said that these stockpiles are there to help states in need. Now, that's what it said yesterday. This morning, that language was gone from the website. So it is perhaps at least encouraging to see that this administration can actually rapidly respond to something, if not to the warnings of a global pandemic.
Stop. Everybody go home. And you know what? It's pretty tough to do that.
That's another thing, that there are rumors that these checks may not go out for another 4 months. Like if you don't
I
have
don't
the
know.
correct
All I can
funds.
tell you is the small business today is that we're way ahead of schedule. There is a problem where, and which I pointed out, I said you shouldn't do it this way, with unemployment. We're 40-year-old equipment by the states. We're sending the money to the states. Once the money is sent to the states, then the states, whether they're Republican or Democrat, have to get the money out to the people. Hopefully they will be able to do it. But many of those states have 40-year-old computers. I don't know that they're equipped. I wanted to give the money direct, if that's what you're talking about. I wanted to give the money out direct. It would have been much easier. But the Democrats and some people said, no, let's do it the complicated way.
I'm talking more about the stimulus checks. Like,
All right, well, I was
when will
talking
people
about,
get their
excuse me,
money?
I was talking about both. Yeah.
Okay, this is a very confusing, puzzling claim that the president keeps making, that unemployment would be more easily distributed via the federal government. Unemployment has always been administered on a state level. The idea that President Trump is suggesting that somehow creating essentially a whole new branch of federal government to distribute unemployment would be the simpler way of doing this, and that Democrats stopped him for political reasons, is honestly an absurd and baffling suggestion.
And everyone who is sick gets provided for. At the same time, we're working on tests and assays that will be critical for surveillance. And at the same time, working on plans for what we need to do as this moves through the population and we get on the downside, which we're not there yet. And hopefully most of the states will say, like California and Washington, and then what we need to do to be prepared for fall. So all three of those things are happening simultaneously, and there's people working on each one of those work streams. The antibody piece is critical, as you described, because at this time we can't, if we have, let's say asymptomatic status is inversely related to age. And so the younger you are, the more likely you are to be asymptomatic. We have to know that because we have to know how many people have actually become infected. So when we talked about 5 days ago, I think on Monday, I called on universities to work on an ELISA-based test to test for their health workers and really get through that. At the same time, the private sector is working on tests. And what do we want those tests to be? We want those tests to be like what we use for HIV and malaria. Finger prick onto a cassette, you get a line if you're positive, and you get a control line. Negative, the line isn't there, and there's the control line. That's our dream assay because it's a finger prick. In the meantime, we're not waiting. I mean, we're pushing for that. At the same time, we're asking to develop an assay, the ELISA-based assay, which requires a tube of blood. And that's why we're also talking about, could we use dried blood spots? We also put out a call directly out to the military because of the Roosevelt to really test all of the sailors on the Roosevelt with an antibody test to get to this critical issue of asymptomatic and already pre-existing antibody. That would be if the first responders knew they already had it and they had protective antibody, if the nurses knew, the doctors knew, if your school teacher knew, then it's a very different dialogue. So we understand the importance of that, and we understand how important it is in relationship to understanding this epidemic.
Now, Dr. Birx just mentioned the naval ship, the Roosevelt, and I just want to highlight this a little bit more. Captain Brett Crozier, the commander of the ship, publicly sounded an alarm yesterday, saying, if we do not act now, we are failing to properly take care of our most trusted asset, our sailors. He was asking for the ability to implement quarantine and isolation procedures because the virus was spreading on the ship. He, following sounding this alarm, has been relieved of his command.
And how to be prepared both scientifically and therapeutically and vaccine-wise for the next fall if that happens again. So I think these things are happening together, but I just want us to really concentrate on the fact that all around the globe, country after country is dealing with this. And we can talk about why didn't Italy do something, or Spain do something, or Germany do something, or we can really say right now, we all can do something. We can do the social distancing and all of the pieces that we know is starting to work around the globe in country after country. And then when we get through all of this, we can ask the questions about, could we have done some piece of this better as a global community?
Well, we know that we could have done pieces of this better as a community. She's referencing the various countries that this has come to one by one. And what each country had more of than the previous one was advance warning. And so the U.S. had a tremendous amount of advance warning. And unfortunately, the U.S. did not benefit from that because the president disregarded the warnings that were brought to him by the intelligence community.
That was a long but a very good answer. That was enough for you.
Insurance coverage. Mr. President, on the insurance coverage for treatment, when your government is trying to make sure that people are covered on the treatment,
we're going to do that.
Does that include the 11 million people who are in this country illegally? Are they going to be covered as well?
We'll be talking about that at a different time. Yeah, please, go ahead.
Yes, Mr. President, will you authorize the release of the underlying data for the conclusion of the 100,000 to 240,000 people sick?
The president has dodged a question as to whether there will be protections for undocumented people in this country. He dodged the question today. In a previous briefing, he took advantage of the question to insult undocumented workers in this country. Our leaders have repeatedly pointed out that we are not facing a food shortage. And the reason we are not facing a food shortage is because our farm workers are continuing to show up for work despite the risks. It is estimated that about 1 million of our U.S. farm workers are undocumented workers, including up to 60 to 75% of California's farm workers. And these workers are in close conditions with few precautions being taken for their health. They are continuing to work at the risk of their health, and it is because of their labor that we have food on our tables.
We're going to compensate you for doing that, and we're going to compensate you at the Medicare reimbursement rates, and you are not allowed to bill that uninsured individual anything. So in many respects, it's better for those uninsured individuals. They're going to get first dollar coverage, they're going to get care in the United States, and the provider is going to be made whole from this program. So it's really an unprecedented, what President Trump is doing here with this money is an unprecedented disease-specific support of care for individuals to make sure that people get treatment.
Will still be billed if they test negative, or what about non-COVID conditions?
I have a couple questions about supplies. One specifically on New York and the question of ventilators. Governor Cuomo is saying that New York may be days away from running out of ventilators. Can you assure New York that going into next week that they're going to have the ventilators that they're going to need?
No, they should have had more ventilators at the time. They should have had more ventilators. They were totally underserviced. We're doing our best for New York. You know, we have states. We have a lot of states. We have territories too, but we have a lot of states that have to be taken care of, some much more so than others. We've worked very well with the governor. We happen to think that he's well served with ventilators. We're going to find out. But we have other states to take care of. We have a big problem in Louisiana. We have a big problem in Michigan. We have a big problem.
The president is repeatedly dismissing the concerns of the state of New York, where he is saying that New York will have the ventilators that it needs. New York is expecting to need 30,000 ventilators. He's also criticizing New York for not already having those ventilators, when the federal stockpile is only 10,000 ventilators. And he is suggesting that other states may need the ventilators more. New York State currently has over 100,000 cases of the coronavirus. That is more than many other states combined. It is not quite half of the U.S. Cases, but it is getting close to it.
We're in power. Okay, our is referring to our country. The states, to the best of my knowledge and to the best of your knowledge, are a part of our country. We are taking what is in the federal stockpile and we are helping states all over the country. But we also want to keep some because when that surge comes, when you hit those peaks, we're going to need, we have to be able to have the flexibility to take those ventilators and bring them to Louisiana, New York, Detroit, different places. That's all.
You will be using
But
them
the
for
word,
the states that
oh,
need
of
that.
course, we're not using them anywhere else. We're not going to be using them, John, anywhere else. But we want the flexibility because, you know, we don't even know when the surge is coming, but it's coming soon and it's going to be big. And some areas won't have it. Some areas will be pleasantly surprised, just like we've been. You look at the chart. States that I thought would have been maybe a disaster turned out to be really, they've done a great job. Some states are really trouble. But you don't know. You don't know. We have great flexibility. I would have preferred giving them all out. We'd have nothing. And now when we have a surge, we can't get them back from where we gave them because it's very tough to take them back. So we have tremendous flexibility. And it could be New York. It could be Louisiana. Those are two that are really rough. New Jersey is very rough. And they've done a very good job in New Jersey, but New Jersey is very rough. Go ahead, please, Nabeel.
Yes, the question is about the CDC guidelines. I know that they changed over time from February, and there's
The guidelines relative to which? The
for
masks?
instance, social distancing and the number of people who can gather in a group and so on. And now we have this measure about wearing masks. And I know you told Steve about why you don't want to wear a mask, but I'm just wondering if you can tell us more about why, because it would
I
set
just don't choose to.
an example.
They're not mandatory guidelines. They're guidelines. They suggest you could wear them. You don't have to wear them. In fact, the director is here. If you want to say a couple of words about it, you can if you want. You don't have to.
And your decision not
But basically, it's a voluntary thing. Say it, director. Doing a good job.
Thank you very much. I think I just want to reemphasize, I've said this before, that we're not defenseless against this virus. We have a powerful tool, a powerful weapon, that is social distancing.
This is Robert Redfield, the head of the CDC, one of the people who was responsible for crafting the military's position on how it would treat or not treat service members with HIV. During the AIDS crisis, Redfield made public statements suggesting that the crisis was God's wrath and urged against the use of condoms.
That's the powerful weapon. And, you know, this virus has a great weakness. It can't jump from one person to another if it's got to swim more than 6 feet. And this is why we really want that. That said, we now know that there may be individuals in areas of significant community transmission that may be asymptomatically infected. And we know that a face barrier can actually interrupt the number of virus particles that can go from one person to the other. So as was said by the Vice President, the purpose of this face covering is to be another adjunctive mitigation strategy to protect someone from spreading the virus from themselves to someone else.
And I was just tested also, so I assume I don't have the virus, so I don't have to worry about spreading it. Okay? Please, go ahead.
Mr. President, I want to make sure we're clear. When you mentioned tariffs earlier that came up in the meeting, are you considering tariffs on Saudi Arabian oil? And
Well,
then
I can always
also,
consider. Look, tariffs have made a tremendous amount of money for our country. I put them on China. I put them on other places. And other countries tariff us, and they take advantage of us, and they have for many years. Look, countries have taken advantage of the United States for years. They've ripped us off like nobody can even believe, whether it be on manufacturing.
Now, the president is again saying that the U.S. is making money from tariffs that he has placed on Chinese goods. I'm not sure whether the president is willfully misleading Americans whenever he repeats this, or if he simply does not understand how tariffs work. Tariffs are not paid for by the other country. They are, in essence, taxes on American companies that import goods from other countries, and the cost is typically passed on to the consumer.
Thing for doing it. Look, they've taken advantage of us for years. Tariffs are a way of evening the score. Tariffs are a way of just neutralizing. They have tariffs on us, and we now can put tariffs on them. Am I using it for oil? It's something we can. No. Am I doing it now? No. Am I thinking about imposing it as of this moment? No. But
Tariffs are not widely economists. During the century, they were thought to be an effective means of governing economies, and actually President Thomas Jefferson ran into as a result of the impacts of tariffs.
Russia is being hurt unbelievably badly, and Saudi Arabia is being hurt unbelievably badly, because oil and gas is a primary, that's where they get most of their income. This is a price like from the 1950s. They are being hurt. I think they're going to settle their dispute pretty quickly.
Why, on the oil, why do you think
Mr. President,
raise the price? Why do you think you haven't been more successful in getting them to increase production in Russia and Saudi Arabia?
Well, they have increased production. That's what they've done. They've increased it so much that there's, so you meant the opposite.
Why do you think you haven't been successful in getting them to
well, they're going to stop because the market, ultimately the market is going to get them to stop. But they both did the opposite. They increased production to a level that water is right now more valuable than oil. Who would have ever thought, right? You go to some of these kingdoms, water is far more valuable than oil. There's so much oil. It's a tribute in a way. But what happened in terms of demand. So there's no demand and there's tremendous supply. So, I mean, you saw numbers where it was down to 20 and down, frankly, below 20. It was even below 20. It's an incredible thing, the market. But ultimately, the marketplace will take care of it. But I think they're going to work out their problem fairly quickly. Okay, go ahead.
Mr. President, thank you, Mr. President. We're already talking about phase 4 of a stimulus, right? But and Pelosi and McConnell are already talking about different things that should be in it. Now, last time, people were telling me that the fact that you wouldn't talk to Pelosi was an impediment and it really slowed things down. Are you?
I'd talk. If it were important to talk to her, I'd talk to her. If it were important for the American people, I'd talk to her. But other than that, I can have other people talking to her. Look, you ready? Infrastructure is a great thing for me. I think infrastructure for this country, we have an old broken infrastructure. 50 years ago, we were the envy of the world. And then we spent all this money so stupidly in the Middle East. We spent, it's going to be very close to $8 trillion in the Middle East. How stupid was that decision? But they spent it on that and other things. We've got to fix our infrastructure.
President Trump has repeatedly called the Iraq War stupid. Whether it was or not is a subject for debate, but what is not a subject for debate is that President Trump supported it at the time.
I've had a chance to borrow at zero. We're going to borrow. This is a great time. So we can fix our infrastructure and we'll have almost no interest costs. This is the time to do it. Steve, one more question.
The death toll projection that you shared with us earlier this week, are we still on the current trajectory for that, or have social...
Which one? I have many trajectories for many things.
100 to 240,000. Are we still on that trajectory, or have we made any improvements, or maybe not enough time has passed?
Say it, Steve.
Have we made enough improvements?
On what? On what?
On social
models. On the models. I'd have to ask Dr. Fauci, and I'd have to ask Deborah. Have the models changed?
This week, the president told us that we should expect over 100,000 Americans to die, and now he is acting as if he does not know if he said that or if those predictions have changed.
I think 6.5 or 5.5 times the size of Italy, a different factor in Spain, and we look at all of those, what their projections are, where they are currently, and where that is going. And so a lot of the work is based on how this virus has moved through other populations. That's a very direct way to see how the virus is impacting a population. There's also terrific models. And so every day and every night, one of the models that actually looks at the model related to mortality is the healthdata.org data. and they update it every night, and you can see where we are in that projection. I think in the last run of that model, they were at 93,000. Don't follow those behaviors. If another major metropolitan area ends up having an epidemic like the New York metro area, that could dramatically change not the model, but the reality of the impact of this virus on Americans.
By the way, the models show hundreds of thousands of people are going to die. You know what I want to do? I want to come way under the models. The professionals did the models. I was never involved in a model, but at least this kind of a model. But you know what? Hundreds of thousands of people, they say they're
the president, while talking about the deaths of hundreds of thousands of Americans, just seemed to make a joke about how he used to date models.
projections. I hope they're wrong. I hope we're going to be under those projections.
Two questions on continuity of government.
How come you always have two? Why can't you have one?
Well, they're related.
Every time. I have three questions. I have two questions. Can you give me one instead? Because you have a couple of other people. Go ahead.
Okay, I'll go with my second one. The governor of Wisconsin is now talking about delaying the primary, or at least not having in-person voting. So my question is, and I asked this a couple weeks ago, I want to see if you've made any progress on this. Looking ahead to the fall, are you taking steps to ensure that the general election will happen even if this pandemic has reemerged or hasn't gone away?
The general election will happen on November 3rd. In Wisconsin, what happened is I, through social media, put out a very strong endorsement of a Republican conservative judge who's an excellent, brilliant judge. He's a justice. And I hear what happened is his poll numbers went through the roof. And because of that, I think they delayed the election.
Concerned about people going to in-person
I
voting?
don't know. Why didn't he do it?
The president has just made a really stunning claim with no evidence that Wisconsin is postponing its election for political reasons. 14 states have postponed their primaries, at least 14, I think it may be more than that now, because we are of an
I hope you're right. I hope you're right. Should vote with ID, voter ID. I think voter ID is very important. And the reason they don't want voter ID is because they intend to cheat. When you get something, when you buy something, you look at your cards and credit cards and different cards. You have your picture on many of them, not all of them, but on many of them. You should have a picture on your for voting. It should be called voter ID. They should have that. And it shouldn't be mail-in, excuse me, it shouldn't be mail-in voting. It should be you go to a booth and you mailed in. You should vote at the booth and you should have voter ID. Because when you have voter ID, that's the real deal. Thank you very much.
Voting by mail would open the door for voter fraud. Oregon, Washington, Colorado are all vote-by-mail states, and they have not had any problem with it. We are looking at the possibility that there could still be a public health crisis in November, and going to a vote-by-mail system could be the best way to ensure the integrity of the election. Voting by mail also relieves a lot of the inherent discriminatory aspects of voting, that it tends to shut out people with disabilities, that it tends to shut out people with work schedules that they cannot get the time around to go vote. So these are some really troubling statements by the president at the end of that address. Also troubling from the president was his insistence on not providing more supplies to New York, saying that the federal government needs to hold on to these supplies in case there is a surge somewhere. New York currently has over 100,000 cases. If that is not a surge, I am curious as to what one might look like. New York has more cases, roughly the same number of cases as New Jersey, California, Michigan, Louisiana, Florida, Massachusetts, Pennsylvania, Illinois, Washington, Georgia, Texas, Connecticut, and Colorado combined. And President Trump is saying that he doesn't want to give any additional ventilators to New York in case a state might develop a lot of cases. New York has a lot of cases. And New York is predicted to run out of ventilators by Sunday. So, speaking to you from here in New York, I wish I could offer more good news at this moment. Ian McKenna from our newsroom has just pulled one more fact about a claim, the president's claim that voting by mail will lead to more voter fraud. The New York Times reports that Oregon, the pioneer in this area, has sent out more than 100 million ballots since 2000 and has documented only about a dozen cases of fraud. So the president is not truly reflecting the issue on voting. So that is for today. My name is Alan Piper. I am the senior politics producer at NowThis. I had the support today of our entire newsroom, and most particularly Emily Barger, Zara Heder, Megan Hirschlein, Mac McDonough, and Ian McDonough. All of them are working from home. All of them are also, like me, like you, concerned about the moment that we try to give you the best possible news. If the president does briefings over the weekend, we will be back to live fact check them tomorrow and Sunday. And I hope the discouraging times that we are in, that you will have a good weekend. Please stay inside, stay safe. Please do as the president says and not as if you go outside. Stay 6 feet away from other people. Please use this opportunity to take care of yourself, to take care of your loved ones, and make sure that they know how much they mean to you. For Alan Piper and NowThis in New York, I am signing off. Thank you for tuning in.